I've always had a fascination with medicine since I was very small. And, if you talk to family, was always playing doctor in primary care back when I was little, and kind of segued that as I be more and more interested in the sciences. Started off in biology and really became fascinated in how stuff works, and kind of parlayed that into medicine years later. I like internal medicine, the opportunity to really get to know a person, to know them from what makes them tick, what makes them interested in coming to see you is they want to know about their problems. And we get a chance, the opportunity to investigate with their problems and really get to know their fears, their frustrations, their anxieties, all the specifics of their day-to-day. When I walk in, obviously I introduce myself and I sit down and say, we don't need to be up at that exam table, we're going to sit and talk for a while. And I really like to get into the weeds with them and figure out a lot of information. I ask a lot of questions in regards to their past medical history, current medications, family history, as well as maybe some of the specifics of their day-to-day. What do you do for relaxation? What is your family situation like? And my job is to get really empower that they take an active role in their day-to-day care of themselves from not only from a mental health side of things, but also from a physical side of things as well too. When we start to talk about treatment options, kind of lay down, this is what's on the table, available, whether it's through a lifestyle thing or if they do require medicines. And we make a decision together. I kind of give them the data and specifics of what is probably the most important things, and then rank it accordingly, and then we come to the decision together. The most rewarding part of my job, I think, is to really get to know the person. I've often said that when I take you in as a patient, or when I see you as a patient, you become one of my family members. I like to treat you like one of my family members. And then once we get that relationship developed and that aha moment comes where they come in and they high-five you because they've lost weight or their blood pressure is finally controlled, it's very rewarding.